Hello, everyone. Heather Holmes here with KTVU Fox 2 News in the San Francisco Bay Area. And joining me once again is Dr. Rashid Chotani. He is medical officer at IEM, and always a pleasure to have you here, Doctor.
It's always a pleasure to be on the show with you for a critical problem that you and I and the rest of the nation is extremely concerned about.
Yeah, and here we are all these months into this pandemic, and the numbers just don't seem to be getting any better.
Not just in the United States, across the world, things are getting really worse. We've got about 21 million cases across the world, 750,000 deaths. In the United States, we've got 5.4 million, approximately 5.4 million cases and about 170,000 deaths. There are multiple states that now have over 500,000 cases, like California, Florida, Texas, and of course, New York had a large number of case fatalities. But right now, we are facing problems in other states, and it's just not getting better. As we had anticipated, as scientists, as citizens of the United States, things are just not getting the way we wanted them to be. So we've got a long way to go. We had about 1,500 deaths on Wednesday, which is which is the largest number of deaths that we've seen during the this summer. And we've got 17 consecutive days of 1,000 deaths per day. So things are just not where we want them to be. It's kind of unfortunate, and that's where we are.
Yeah, this COVID-19 is really persistent. Talk with me about some of the issues, the challenges, still with testing and still with contact tracing.
Yes, we've got a major problem with testing and contact tracing. To be honest about it, let's first talk about testing. Now, we had been testing quite a bit, and what I've seen and the data is showing that we've got 35% less testing going on in the nation. And what we are seeing is that we are getting the testing that is being done. We're seeing that more positive cases, or positivity is being reported, which is an early indicator that there is going to be a surge. So I'm extremely worried about that, because if we have the number of positivities increase, and yes, I understand that in certain states right now, because you just don't have the capacity, you're only testing people who are symptomatic, but the number of positivity increasing and the number of positivity that we are seeing in states like Texas, over 24%, is just mind-boggling and extremely worrisome.
Yeah.
And then, yeah, I'm sorry. And then then we've got tracking, right? I mean, can you imagine that if we have 10,000 or 20,000 or 50,000 cases per day, how are we going to do the tracing for them? Because each individual is going to go out and meet 3 to 5 people, and then we've got a huge number that we've got to deal with on a daily basis. So we just don't have the resources right now, and we're caught in a position where the only thing that we can do is do smart things, intelligent things as individuals, and do the masking, social distancing, washing our hands, and just using common sense measures to decrease the total number of cases that we see, so that we can have some control over the disease and we can contain this virus, and then we can do the contact tracing, because with the numbers that we have, it is just going to be impossible to do that.
Yeah, it certainly is obviously still a long uphill battle, but I do want to talk with you about vaccines. There has been some encouraging news. And first, I want to talk with you and get your take on Russia, claiming that it has been victorious, the first to create a vaccine.
Yes. So let's backtrack a little bit. On average, when a vaccine is developed, I've spent most of my career in this type of work. The average is about 11 years that you develop a vaccine. Right now, we've got 170 vaccines in the preclinical, that is in the lab, being tested on animals, etc. We've got about 15 vaccines that are in phase 1 studies. That means one number of people are being tested on it, and young, healthy individuals, and they're looking at the safety and the correct dosage on that. Then we've got 3 vaccines that are in phase 2 studies right now. We've got a large number of groups, and we include in them high-risk individuals. And then we've got the phase 3. which is the most important phase, the last phase. And we've got 6 candidates right now in that particular phase 3, and where we check efficacy and the safety of the vaccine. Now, Russia has claimed that it's got a vaccine, and it's ready to, it's launching the vaccine, which is great news. And I mean, from a global citizen perspective, I think this is remarkable. If Russia has a vaccine, then let's take a look at it. But unfortunately, we just don't have the science or the scientific data behind it, and we don't know, based upon our FDA, the Food and Drug Administration's rules and regulations, if those critical things that we are looking for from a safety perspective, from efficacy perspective, from dosage perspective, have they been addressed properly or not? So unless and until we, the scientists in Russia disclose all that information, it's going to be very difficult for us to say, well, gee, we've got the problem solved.
Yeah, there are definitely going to be questions surrounding that claim until we get that information. Doctor, though, go back to some of the vaccines that are under development here, because there are a large number.
Yes, there are a large number. I mean, the amazing thing that we as a nation have been able to do, and I've got to give credit to the administration that we put $9.5 billion into Operation Warp Speed, and as I told you earlier, it takes over 11 years to develop a vaccine. I mean, this vaccine, well, Russia has developed it as it claims. China has developed one that it's claimed it's giving to its armed forces, but irrespective of all of that, if we can have a vaccine, and we are in phase 3 studies, which has been the fastest, the quickest I have ever seen in the history of vaccine development, a vaccine getting to that particular point. Right now, we've got, Russia has Sputnik 5, as they're calling it. We've got on July 31st, we had Sanofi and GSK from UK. They were given $2.1 billion from the US to move forward with manufacturing. On July 27th, Pfizer and Moderna started their phase 3 studies. These are the large studies that I talked about, 30,000 patients being enrolled in the clinical trials. So, things are just moving extremely, extremely fast. And if we can get a vaccine that is effective or efficacious, as we call it, in 15% of the individuals to develop immunity or decrease the severity of the disease, then, to be honest about it, I and a lot of other scientists, majority of the scientists in the United States and across the world, would be very, very, very happy.
Yeah, that would be something that I think all of us would be able to celebrate. One of those trials is actually going to be recruiting volunteers here in California, which is significant. Talk, though, about how these studies take place. They're completely randomized, meaning the person who's getting the vaccine may not actually know if they're getting the vaccine or placebo, and why that's important.
So it's very important to see, because you've got to take a look at, if you give somebody a placebo or an intervention or medical countermeasure or a vaccine, you want to see if there's statistical difference in terms of if the vaccine is producing the T cells and the immunity that you are looking for in that individual, and how the body is responding. So that is what we want to observe. Now, if, for example, and this is again, you know about the hydroxychloroquine, right? Now there's a study that is saying that it might be efficacious as a drug, but earlier studies looked at it in patients it was given to, and then a group that it was not given to, a placebo was given to, and they did not find any difference in terms of disease progression, or in terms of decreased hospitalization. So what we are looking at are differences, and we've got to have a statistically significant difference between the group that is given the placebo and getting a significant advantage if you are vaccinated by one of these vaccines, and you see that the person develops a better immune response, does not develop the disease, and is, and that is what we are looking for, because right now 30,000 individuals that it's going to be tested in are going to be, this is going to include the high-risk individuals also. We also know another fact, that about 54% of the nation is obese, unfortunately, and that is something that we've got to do as a nation to decrease that problem. And we've looked at the historical, vaccine strategies, where they worked, where they've not worked, and it is clear that obesity is an adverse problem in terms of developing immunity if you're vaccinated. So that is going to be another problem that we'll have. We will have other problems right now, as you know, that the anti-vaccine campaigners are out there
Yeah.
pushing the agenda that we should not get vaccinated. But we've got to move forward. We are moving forward. And, the nation has invested more than enough money and more than enough resources in terms of developing a vaccine. And I think we are on a trajectory. And I'm cautiously optimistic, but I am optimistic that we will have a vaccine before the end of this year. I am not 100% sure that that is going to be for the masses in terms of mass vaccination campaigns, because that requires a lot of work, like what you see in tracing, right? Contact tracing. You got to have individuals who go out and vaccinate. We've got to have vaccination campaigns across the nation, and we've got to vaccinate all ages across the board. It is going to be a monumental task, but I believe that the vaccine is going to be there. And then by the middle of next year, we should have a sufficient amount of individuals that are vaccinated to be able to develop some herd immunity. If that is the case, and next year will not be as bad. But this year we've got to be very careful, because remember, in October timeframe we are going to have the flu epidemic come, and flu, there's going to be a lot of confusion as to what do you have. Do you have flu or you have coronavirus? So that is going to be a serious problem that we are seeing. We've also seen that other nations where numbers have gone down and they were really celebrating and jumping up with joy, now they have more cases showing up. So we've got to use we've got to be smart about this thing, look at the data on a constant basis, and do phase in, phase out whatever is needed to make sure that we're saving lives, using smart lockdowns in areas where there's high intensity of the disease. There has to be something that is going to balance things between the disease and the economy. And that's a very difficult balance and a very difficult decision for people to make. Fortunately, I'm not going to make that decision, but we've got to come up with some really good solutions in the absence of a serious medical countermeasure against this disease.
Yeah, balance, I think, is what we're all searching for. Dr. Chotani, always a pleasure. Thank you so much again for your time. Appreciate it.
Thank you so much for having me. And wear a mask, social distancing, wash your hands, use common sense measures. That is going to save a lot of lives, yours, your neighbors, your families, your community. With that, thank you so much for having me.
Important final message. Thank you, Doctor.